Hello, I am Dr. Naveen Chandra G S. I am the lead consultant in the Department of Cardiology, Aster Hospital, Whitefield. Mr. Jogi Bhar is around 78-year-old male. He had a history of angioplasty done a few years back. He had come with exertional breathlessness, tiredness while walking, etc. He has been a known case of something called aortic stenosis. Aortic valve is one of the valve which guards the main artery of our heart called aorta. Now that valve, when it degenerates, that is called aortic stenosis. So there is an obstruction to the outflow of the blood there. So he had been having aortic stenosis for some time, but in off late last few months there was a significant stenosis, and the obstruction became much severe. So this condition is called aortic stenosis. The reason why he developed aortic stenosis is that he has something called bicuspid aortic valve. Normally aorta is guarded by three cusps. It's like a door to the main artery. So there are two cusps. So in such individuals, there is a degeneration of the aortic valve much faster than other individuals. So the aortic valve was completely damaged and there was a severe stenosis. So this condition requires the replacement of that valve. Conventionally, what we used to do is open surgery, aortic valve replacement with another artificial valve, which was a conventional treatment over the period of many years. Now he was 78-year-old. He had history of heart and stenting in the past. So in such individuals, the open heart surgery is a much higher risky affair, and which is meant with higher mortality, higher morbidity, hospitalizations, infections and bleedings, etc. In such individuals, we advocate a procedure called TAVI.
I am Jogi Bhar. I live in Whitefield, Bangalore. 10 days ago, procedure was done on me called TAVI, TAVR, for valve replacement in the heart. The procedure was done by Dr. Naveen Chandra and his team. Dr. Naveen Chandra has been looking after me and monitoring me for last 5 years, and I'm really grateful to him. As you can see, I am hale and hearty right now, and the procedure has been very successful. I humbly thank the whole staff of Aster who have taken care of me during this procedure and thereafter. I would like to especially thank Dr. Naveen Chandra, who has been very kind and who has really taken care that I have been comfortable. And I also thank his entire team for being so attentive to me when the procedure was done and thereafter.
TAVI, also called Transcatheter Aortic Valve Implantation, is a percutaneous, minimally invasive procedure. Means we take a valve, which is a crimped valve from the leg, from the femoral artery. So we take the valve into the aortic, the place where the aortic valve is there, and we deploy the valve. Now, the entire procedure takes around half an hour to 1 hour. It is done under local anesthesia, and the valve is implanted in the position where the normal aortic valve is present. Now, patient can be mobilized within 6 to 8 hours, sometimes the next day, and the patient can be discharged at the end of second or third day. Mr. Bhar underwent this procedure a few weeks back, and the valve was implanted and he was mobilized on the next day, and the third day he was discharged without any major complications of bleeding, etc. Now this because of this such a less invasive procedure, patient doesn't get any open heart surgery or any cuts in the chest, and the procedure can be done under local anesthesia, and which has a very, very low risk, and the mortality and the morbidity, hospital stay, complications, everything is very, very less compared to an open heart surgery.
Hi, my name is Pooja Bhar, and I'm the daughter of patient Jogi Bhar, aged 77. We came to Aster Whitefield for a procedure called TAVR to get his heart valve replaced. Our main reason to identify Aster Whitefield to get this procedure was Dr. Naveen Chandra, who has been our family cardiologist. Dr. Naveen has taken care of my brother and my father for the last 7 to 8 years. And as usual, he did a great job. And we cannot thank him enough for his kindness compassion and humanity towards us and towards the other patients that we have recommended to him. And more than anything else, I also want to take this opportunity to thank the staff of Aster. Even the nursing staff is highly trained. We do not see that in many hospitals in Bangalore. Given the amount of nursing staff India produces today, half of them are exported abroad. So Aster is one hospital where the nursing staff is really competent, and they're also they're always there for you when you need them. And I would like to thank the cardiology team, even the canteen at Aster Whitefield, because we do end up using the canteen when we stay here, when our patient is here for over a week. My dad this time was here only for 3 or 4 days, but we visited the canteen, and even the canteen staff, they're really ready to help you. So overall, our entire experience with Aster has really been really great compared to the other hospitals. You have a very depressing environment in hospitals. It's not so in Aster Whitefield. Once again, I would like to thank Dr. Naveen Chandra from the bottom of my heart, and his entire team, and all his technicians, like Mr. Mohan, who's always, he's taken so much care post-operative, to get my dad's echo and everything. Thank you so much.
TAVI, or a transcatheter aortic valve implantation, is a procedure which is suited for such older individuals or debilitated patients or having kidney disease, low heart functions, who are a very high risk for open heart surgeries, where we can implant through the leg without any surgery to reduce the overall hospital stay and complications. And this is the ideal procedure for such candidates. Thank you.